without further ado, I'm really excited to introduce our speaker. Our speaker today is Litsa. Is that how you say it?
Yes, Litsa.
Litsa Tanner. She's going to tell us about behavior experiments and how we can use them to change the thought patterns, the belief systems.
Belief systems, yes.
Of our clients to help them do better.
Yes.
Litsa, let's see, is an MFT
Yes.
and co-founder and clinical director of the Santa Rosa Center for Cognitive Behavioral Therapy. She's been using CBT for over 16 years, right? Working with adults, children, and adolescents. And her specializations are anxiety of all sorts.
Yes.
Sounds like anxiety and habit disorders like skin picking and trichotillomania. And you actually went to school for trichotillomania, right?
Yeah, so I did the intensive training through the Trichotillomania Learning Institute, and so I've gotten a lot of advanced training in that area.
Awesome.
Yes.
And major behavior problems in young children.
Yes.
Okay,
Absolutely.
great. Well,
Thank
we're
you.
totally looking forward to hearing what you have to say. Take it away.
Great. Thank you very much. Well, thank you so much for having me. I am going to, I just realized I want to try to move something so I can cheat. There we go. That way I don't have to look back at the screen here. So, as Chris had just told you so generously, I am from the Santa Rosa Center for Cognitive Behavioral Therapy, and I want to just give you a little bit of quick information about the center. Many of you may already know, but to just give you some information about us. So we are dedicated to evidence-based therapies and specifically cognitive behavioral therapy. We also have an intensive training program, and you met our two interns right now, Brian and Melissa. The great thing about our intern program is that it does allow us the opportunity to provide sliding scale services to the community to make our services more accessible, and then also provides intensive CBT training for new therapists. And then also in the last year, we've also started to expand our consultation services for other clinicians. So specifically for therapists who might want to be specializing in CBT, but also therapists who are just wanting to incorporate more CBT into their current theoretical orientation. And so I do both individual consultation as well as have a group, a consultation group that meets on the third Saturday of every month. So today, as Chris had mentioned, we're going to be talking about behavioral experiments and how you can use behavioral experiments with clients to shift unhelpful or problematic belief systems or thoughts. So before we start with that, though, I do want to do a quick review of the CBT model just so that we're all kind of coming from the same starting point when we're talking about behavioral experiments. And so just real quickly, by a show of hands, how many of you have any formal training in using behavioral experiments or have read about behavioral experiments? Excellent, good. So a good number of people are familiar. And how many of you feel like you incorporate CBT interventions or principles into your work? Nice, everyone, good. And does anybody feel like they're a solid CBT specialist, that's your main orientation? I know there's not many of us around. The interns, you guys better raise your hand. No. So let's do real quickly then. And so what I'll try to do is there is going to be some review of things today, but absolutely I encourage you to raise your hand and ask questions if you have more specific or fine-tuning questions of how to use these things, especially if you've already been using them a lot in your practice, most definitely. So remember in the CBT model, we're looking at the four different systems within ourselves, our thoughts, body, feelings, and behavior. And we look at how all these things interact with each other and affect one another. And so today what we're going to be focusing on is how you can shift thoughts by focusing on behavior. In my work, I tend to describe myself as being a little bit more behaviorally oriented than cognitively oriented, simply because I think that we're actually far more effective in shifting cognitions by actually experiencing new or different things. It's really difficult when you have a lot of experiences that have reinforced and are supporting your beliefs. It's really difficult to just try to think something different or believe something different. We usually have to experience something different. And so that's what behavioral experiments are a lot about. So let's look at a quick example of outlining this model. So if we have an example of insomnia, so oftentimes a triggering event for somebody with insomnia is that they're laying in bed at night awake, and they're having thoughts like, I may never fall asleep, if I don't sleep well tonight, I'll have an awful day tomorrow, and this is hopeless. Understandably so, that's going to cause a lot of feelings of anxiety and frustration, going to increase some of those physical sensations going on, so they're going to feel restless, fidgety, tense, have racing thoughts. That tends to increase their frustration and anxiety, tends to reinforce all those thoughts about not being able to fall asleep and how awful that's going to be, which then results in the behavior of laying in bed awake, oftentimes staring at the clock, and then eventually oftentimes taking sleep medication, which then starts to reinforce a larger belief system that the person may hold, which is that I can't sleep without medication. And for insomnia, that can become quite problematic because we do know that sleep aids, although they can be very helpful in the short term, aren't all that helpful as a long-term solution for insomnia. So this becomes a very problematic belief. So again, what we're going to be looking at today is how we can work with that belief by working through things behaviorally with clients. So what are behavioral experiments? Behavioral experiments are where we are testing a belief or gathering information about a situation or some belief systems. A really common cognitive restructuring intervention that a lot of people are familiar with is the intervention of finding the evidence. So this is where you have a belief, maybe let's say in panic disorder, the belief is that the physical sensations associated with panic, such as racing heart, difficulty breathing, feeling lightheaded, all of those kinds of things, that those are all signs or symptoms of something more serious happening and danger or a problem going on. So you have this belief that these physical sensations equal danger. So what we might do when we're doing finding the evidence is we will say, okay, well, what's all the evidence to suggest that this is true, that these physical sensations are indicative of a bigger problem or something dangerous about to happen. And so we might go through different experiences or situations that they've had, list out all that evidence. And then we go over to the other side and we say, okay, well, what's the evidence to suggest that this thought may not be completely true? And we list out all of that evidence. And then have the client look at both sides and say, okay, well, based on this evidence that you've written out, what does this tell you about your original belief that these physical sensations mean something more serious is going to happen or something dangerous is going to happen? And oftentimes finding the evidence is a really powerful intervention for people. Well, one of the limitations of finding the evidence, though, is that it's still very cerebral. It's very much so in the head, disconnected from the experience that they're talking about. And so a lot of times what will happen is you'll have somebody say, well, I know that makes sense, but it just still feels so true, right? And so they're really enmeshed with a thinking error in CBT that we would refer to, which is emotional reasoning. Because it feels true, it must be true, kind of an idea. So finding the evidence has some real limitations to it because of that. And so what behavioral experiments are doing is they're building off of that kind of idea of finding the evidence, but just using a more experiential way to go about doing it. So many of you may be familiar that at the center in our anxiety disorder treatment programs, we are an exposure-based treatment program. So and some of you may have even heard myself or my colleague Jennifer Shannon talk about exposure therapy. And so a lot of times when I talk about behavioral experiments, exposure therapy comes up because they can look really similar to each other, and sometimes people get a little bit mixed up about what's the difference between them. So in exposures and behavioral experiments, oftentimes the outcome is likely to be the same, which is that they're going to have a shift in beliefs afterwards. So their belief system is going to change. However, the intention going into them are very, very different. So the intention in exposure therapy is habituation, or as I like to put it, recalibrating the brain. So in the case of the panic disorder, my brain is setting off false alarms. It's over-interpreting those physical sensations as dangerous. And so what the purpose of exposure therapy is to help retrain my brain to no longer interpret those physical sensations as dangerous. And the way that we do that is with gradual repeated exposure, because if I approach something enough, my brain decides, oh, this must not be a problem. And then within that, there's oftentimes some corrective learning going on about increasing the person's belief in their ability to tolerate high levels of anxiety or tolerate distress. Now, the big difference you're going to see between exposures and behavioral experiments is that in exposures, there's already a worked-in assumption that the situation or the feelings or whatever is going on is not dangerous. So when treating panic disorder from an exposure-based perspective, one of the first things I'm going to do is give them some psychoeducation about panic attacks, and that panic attacks are not dangerous. Nobody has ever died from a panic attack. Feels like you're going to die, but you're not. Fear of passing out, actually, you rarely pass out when you're having a panic attack because your blood pressure is going up, which is the opposite of what you need in order to pass out. You need a sudden drop in blood pressure, right? So I'm going to give them all of these things because we are operating from the assumption that the behavior of the situation is not dangerous, but that my brain is misinterpreting it. And so this is the biggest difference between behavioral experiments and exposures, which is behavioral experiments are done with the expressed intention of testing the belief. And a lot of people get confused and they think that we're doing behavioral experiments to show the client that their belief is inaccurate. But that's not true at all, because their belief might actually be true. I don't know. It could be true. Maybe there is something dangerous that's going to go on. Maybe they are going to be that one person who passes out. I don't know. I really don't know, right? And so in behavioral experiments, we're going to align with the client's uncertainty. And the idea is, could we test that out? Could we find out if that is true? Because usually what's happening with problematic beliefs, whether it's in anxiety disorders or other things, the person is avoiding situations that could actually confirm or disconfirm the belief. So they're operating on this assumption, but it's actually never really been fully tested out. And so that's what we're doing in behavioral experiments, is we are aligning with that uncertainty and asking, can we test this out? Now, oftentimes I use an example of a panic attack, right? And so one of the big fears is I'm going to have a heart attack with a panic attack. So you might say something, oh, would you be willing to test that out? It's like, no, no, I would not be willing to test that out, right? So in behavioral experiments, we are oftentimes working in safety nets of, okay, so how can we test this thing out and reduce the riskiness of it? So we can still find out how true is that belief, but without taking larger risks. And so I'll talk with you guys. I've got a little sneaky one down here. I'll talk with you guys a little bit when we start to get into the details of behavioral experiments, how to do that. All right, any questions so far about the differences between exposures and behavioral experiments? No? Okay. This made me think of somebody was talking to me today, Maggie, right? Asked me today about, with exposures and behavioral experiments. And something to keep in mind is that if you're wanting to work with somebody from an exposure-based place, but they're very, very fearful of the exposures, behavioral experiments are oftentimes a nice primer to get them to the place of being willing to then do the exposure. So we can do some experiments to test out their fears about the riskiness of exposures, which then can get them more willing to then shift into a more straight exposure-based approach. So they're not mutually exclusive from each other at all. They can be nice complements to each other. So I'm not going to talk at all today about how to identify thoughts or accessing clients' thoughts. You guys probably have all different ways of doing that. There are some really great ways in CBT of doing that, but we're going to jump right into the thoughts. What I do want to talk about is what kinds of thoughts and beliefs tend to lend themselves easier to doing behavioral experiments, because there are certain groupings that are easier to test than others. And so in CBT, we tend to think of a hierarchy of different kinds of thoughts. At the top of that hierarchy is the automatic thoughts. These are the first thing that pop into your head in situations. So it might be something like, everyone is staring at me, they all think I'm stupid, nobody understands what I'm saying, those kinds of things. So first, really quick images or thoughts that pop into your head in situations. The next level down is our rules and assumptions. These are the rules which are assumptions that we make about the way that the world works, how I interact with the world, and how other people interact with me and each other. So rules and assumptions are usually the basis for our automatic thoughts. That's why in the pyramid, they're underneath, they're feeding the automatic thoughts. And oftentimes rules and assumptions are worded in if-then kinds of statements. So if I raise my hand and answer the question wrong, then everyone will laugh at me. Okay? Our last one is our core beliefs. So these are the really concrete, they tend to be really short, direct, no vagueness in them at all. Beliefs about ourselves as a person, also about the world in general. So the core beliefs might be something like, I'm a bad person, I'm not good enough. Core beliefs might also be the world is dangerous, other people are untrustworthy. Those are core belief kinds of ideas. Core beliefs as many of you know, because this is what we oftentimes are all working with, are extremely difficult to shift. They're very, very hard to change. They're also not very well suited for behavioral experiments. Because if I have the belief I'm a bad person, how am I going to test that? How do you even begin to quantify what that means or doesn't mean? They really do not lend themselves well to behavioral experiments. I do not recommend trying to do a behavioral experiment around a core belief. It will be extraordinarily frustrating for both you and your client. The other thing is that what I tend to do, I recommend for clients or for therapists, is that when you're working with core beliefs, rather than trying to change the core belief, because they are very difficult to change, what is oftentimes more effective is that you try to bolster up their balancing belief, because core beliefs all have a balance. We all have the negative ones. It's just that if we're a little bit, feeling better about ourselves and in the world and feeling good about our accomplishments, it's just that the balancing belief of that I am a good person, I'm competent, people like me, is just getting activated more than the I don't know what I'm talking about, I'm not a good speaker, or those kinds of things. So in works with clients, what the problem is not that they don't have the balancing belief, it's just that the negative one is getting overactivated. And so what we want to do is look at how we can activate the balancing belief more. And your behavioral experiments in the area of rules and assumptions and automatic beliefs are likely to do that. And the automatic thoughts and rules and assumptions are much better targets for behavioral experiments. Automatic thoughts are oftentimes super easily shifted by behavioral experiments. So for example, everyone is staring at me. That's a super easy thing to test. I just look around the room and count how many people are actually staring at me, right? Really super easy to quantify and super easy to test. Now, the only problem with it is because automatic thoughts are our surface ones, they don't influence any of the other two, these changes tend to be pretty surface. So they don't do much to the belief systems or the rules and assumptions. Yeah?
Say that last part again. What doesn't influence what?
Automatic thoughts don't influence rules and assumptions or core beliefs. Core beliefs and rules and assumptions influence automatic thoughts. This is a one-way road here. And so you get very surface change. If you really only focus on automatic thoughts after your experiments, you're going to have this beautiful experiment where it's like, okay, so I think everyone is terribly bored with my presentation. So I go around and I look and I see some nodding heads and I determine, okay, yeah, there are some people who are interested in what I'm talking about right now. What you're going to get is you're going to get a yeah, but, because the rule and assumption is still strongly in place. So you'll actually get much better long-term shift if you focus on rules and assumptions. You usually have to do more experiments. You have to do multiple experiments to get things to shift. They're much easier to shift than core beliefs, though. And the nice things about rules and assumptions is they're already stated. They're almost completely operationalized for us. And I'll talk a little bit about what I mean by that in a little bit. But if I say, if I raise my hand and answer the question wrong, everyone will laugh at me. That's my rule and assumption, right? That's a behavioral experiment stated right there. Okay, so raise your hand, purposely answer the question wrong, and count how many people laugh at you. Right? I have to do there's still some operationalizing we need to do in there, but it's almost already all done for me. So that's the other reason why rules and assumptions are my personal favorite to target in on. The other reason is because they are going to influence your automatic thoughts. And they will start to trickle down into core beliefs a little bit, simply because then we can start to say, well, if this is true, then what does that say about this balancing belief that maybe you are competent, maybe you are good enough? And that's where you start to then be able to bolster up that balancing belief. Okay, any questions there? No? Okay. So some other examples of types of thoughts that we can test out. If I don't get enough sleep, I will not be able to function the next day. Forcing myself to get out of the house when I'm feeling depressed will not make a difference in how I'm feeling. If I don't do my compulsions, the anxiety will only get worse and worse. And if I let myself think about throwing up, I will end up making myself throw up. So those are all super easily testable thoughts. Now, the other thing that I just realized I forgot to mention about the big difference between exposures and behavioral experiments is that exposures are really a specific intervention for anxiety. Right? If I have a depressed client who's, thinking about, how horrible their life is and how, it's never going to get better, if I say, okay, yeah, let's just go ahead and dwell on that and think about that a whole lot, that's not going to improve things, right? So exposures are really specific to anxiety disorders. So the other nice thing about behavioral experiments is behavioral experiments can be used with everything. Behavioral experiments are applicable to all kinds of problems and disorders. So they're far more versatile than exposures are. So there are two different designs of experiments, and this is, any of you took your, research classes in, your graduate programs and stuff, this is going to start to look really familiar because that is what we're doing here. This is, and oftentimes I do, especially with adolescents, I'll talk about we are being like scientists here. And especially when we talk about having to repeat behavioral experiments, right? I say, do scientists set up their experiments and then just do it once and say, oh, that must be how this works? No, you have to repeat it over and over and over again. So it's a good metaphor for people. So our first design of behavioral experiments is hypothesis testing. So this is where we have some sort of hypothesis about what the outcome will be. So there is a feared outcome or a really clear belief that the client has. And so our first option is an A testing. So this is where we're testing the unhelpful cognition. So if I blush, others will notice. That is my unhelpful cognition. We're going to go out and test that out to see if that's accurate or not. Our second design is an A versus B setup. So this is where you have your unhelpful cognition tested against an helpful, an alternative one. So we have, if I blush, others will notice, versus only some people will notice me blushing. So an A-B setup is really great for if you have a client who does have some access to some alternative beliefs. And so an A-B setup is really, really great in your behavioral experiments. If you have a client who's really strongly entrenched in their unhelpful belief, it's better to just stay with an A. Because if you try to introduce in the B too much, then what you're going to, the trap that happens with clinicians then is that we are trying to set up an experiment that's going to prove B. And remember, the first thing that I said about behavioral experiments is that behavioral experiments are not set up to show the client that their belief is incorrect. Maybe everyone will notice when they blush. Maybe everyone will laugh at them. I don't know, that is very possible, right? And so if they're really aligned with their A belief and you introduce in the B, not only are you more likely to be falling into that trap, but your client's going to get really resistant because it's going to feel like you're trying to convince them rather than coming from a genuine place of curiosity of let's find out. Our last one is a B-only testing. This is for where you've already done an A testing or an A-B testing, and there's pretty clear evidence that B is accurate, and now we're trying to bolster up the B evidence. And so it's, well, let's go out and test this some more, because you might have the client saying, okay, well, those people didn't laugh at me, but if I was in this situation, they would laugh at me, or if I did this, they would laugh at me. Okay, great, let's test that out and see. Okay, or that going out for a walk helped my depression this time, but I don't think it's going to help it every time. Okay, great. Well, could we test that out some more? If you're really coming from a place of embodying behavioral experiments, you're going to be using lots of words like, oh, could we test that out? Would you be interested in finding out how accurate that is? How many times would you have to go for a walk to find out whether that's true or not? These are all the kind of language of behavioral experiments. Yeah?
So when you balance...
Oh, hang on just a second. I'm being reminded that you're supposed to have the microphone.
I can talk about
I think it's for the video also. There you go.
So when you have the negative, if I blush, others will notice, do you as a clinician introduce the balancing, or do you wait for them to come up with their own balancing?
So I wouldn't introduce it at all, no. I would, I'm going to be doing a lot of, assessment and gathering of like what are their core beliefs and thoughts before we start going into behavioral experiments. And so if they have the balancing cognition, it's already in place. It's going to have come up in the natural interaction and doing like thought records or those kinds of things. This is a little bit of the missing piece today, that we're not talking about how do you get to those thoughts. But no, I wouldn't. Not unless, if they're not bringing it up, no. The closest I might get to is I might say, was there any other possibilities or any other explanations of what would happen? I might ask that to see if it'll get to it, but otherwise, no. Because I'm going to wait, because this is like that downside of the cognitive, just really staying up in the head. Because if they're not bringing it up themselves, then they really aren't believing it. And so doing the cognitive stuff isn't going to shift it much. Sometimes when I do finding the evidence, and we start off with like, if I mess up or if I blush, everybody's going to laugh at me. And I say, how true does that seem? And they say, oh, it's 90% true, or it's 100% true. Finding the evidence intervention is going to be extraordinarily hard because only 10% of their brain is accessing any alternative evidence. That's nothing, right? So I'm actually already thinking, oh, we need to do an experiment. And we'll talk about types and how to set them up to get somebody to be willing to do it in a minute, but I need to do an experiment because anything I say right now is not going to shift this person's belief at all. Now, our second design of experiments is exploratory or discovery experiments. This is where the person really doesn't have a strongly held belief or idea or fear of what's going to go on. They just know it's bad. I just don't do that. What would happen if you do? I don't know. I just don't do it. Say, okay. Well, would you be willing to test it out and find out what happens, what the possibilities are? So these are where we don't have a hypothesis going in. It really is a discovery. Let's go see what's out there and what happens. Okay? So the different types of experiments, there are two different types of experiments. The first is an active experiment. So this is where the client deliberately thinks or acts in a different way in the problem situation. So an active experiment, an example of that might be saying hi to 5 people while walking down the street. That could be an active experiment. It could be, the going for a walk to see how that influences my depression would be an active experiment. So I am personally, as the client, actively doing something different. It could also be to think and do something different. So if you're doing some like mindfulness exercises and the person is really resistant to the mindfulness exercises, we could use a behavioral experiment. And we could say, well, would you be willing to test this out to see? Because maybe they say, well, that's stupid. It's not going to help me. I've tried that before. It doesn't do anything. Okay, that's understandable. Would you be willing to test this out and see, though? And so then their behavioral experiment is actually to do the mindfulness exercise. Okay, and again, we'll talk about how to set it up so that you're actually going to get some benefit out of that. The next one is observational experiments. So these are oftentimes used when the client is really resistant to doing the active experiment first. So for example, with the if I blush, everybody will notice, the person may be really resistant to doing that because they really believe that everyone is going to notice. And so what we might start off with is a direct observation, and this is most oftentimes with the therapist. So the client observes the therapist engaging in the behavioral experiment. So in my example of walking down the street and saying hi to 5 people, instead of the client doing that first, I do that first, and they're with me and watching me say hi and observing the responses to other people to me. You can also observe other people in the world as well too. So we could even go, okay, let's go sit in a coffee shop, sit kind of in a corner where you're not really being noticed, and let's observe people. And we're going to be looking for specific kinds of interactions or those kinds of things. The other kind of direct observation is a survey. Surveys are one of my personal favorite observational ones, just because they're fun, because the results you get from it is like, oh my gosh, that's so fascinating. I never would have thought people would have said that, right? So surveys are where the client and or the therapist actually surveys other people about the situation. So what you're actually doing here is surveying other people's beliefs about the same situation. I say the client and or the therapist because my personal approach is that if you're going to do a survey, you need to have at least 10 people in your survey. Surveys with less than 10 people don't get enough variation. And you actually want variation in your survey, because if everybody gives you the same answer, I'm a little skeptical of the validity of that survey, because we just know in a pool of enough people there should be different answers. And clients will be skeptical, especially if everybody comes back with a B-confirming hypothesis. They aren't going to be like, oh my gosh, my belief is so wrong. Look, everybody believes the opposite. They're going to be, yeah, those people are blah, blah, blah. Okay, so if you have a variation in your results, the client is far more likely to take in both sides of the evidence. And a lot of times clients just won't have enough people that they feel comfortable surveying, so I survey people. It's funny because most all clients will be like, well, you're going to ask other therapists, because I don't think other therapists are representative. And I say, nope, I won't ask other therapists. So my friends and family are very used to getting these email surveys from me. Facebook is really nice too. One time I did a Facebook survey on it. And so you get a really wide variety of them. But with a survey, what you're going to do is you're actually going to sit down and the client is going to construct the questions. So you're going to construct the questions very specifically. And we're going to say, okay, so we want to be careful how we word these questions, because we don't want to skew people's answers in either direction, right? We want to make sure we're getting accurate answers. So in the case of the saying hi to people, the questions that we might come up with are, if you were to say hi to 5 random people while walking down the street, how many people do you think would say hi back to you? How many people would ignore you? How many people would give you a dirty look? What would it mean if no one said hi back to you? That's the most important question, right? Because not only do we want to know what do they think about the number of people, but then how would they interpret the results? What meaning would they bring to that? And what would it mean if some people ignored you or if some people gave you a dirty look? So that might be an example of a survey. All right, gathering, so our third observational one, this is a really tricky one that it's a rare one for me to do this, but gathering general information from other sources. This is a basic research project. This most oftentimes where I'm going to use this one has to do with like OCD contamination fears. If they're really resistant around contamination exposures, then we may do a behavioral experiment around finding out what the recommended guidelines are for handling certain kinds of substances. So for example, recently I had a client where the contamination fear was around rat feces, and so we did actually go look up on the Now the tricky thing is with this one is if you're going to go to the internet, I actually tell them specific websites so that we'll make sure we're getting good quality information, and that's the downside of these ones, is where are they getting their information from. So we actually went and looked at the CDC website to look at what are the recommended precautions around handling rat feces. But I rarely stop there, because that is not interesting to me. What is more interesting to me is, okay, so those are the recommendations, but what do people do with those recommendations? How many people actually follow those recommendations? How closely do they follow those recommendations? And that's the more interesting piece. And so then once we have the actual recommendations, then we do a survey of people to find out, okay, so what would you do if you came in contact with rat feces, right? And we have our detailed questions there. And again, really interesting, because you're always going to have a spectrum of people who are following those CDC guidelines pretty closely and people who are not, okay? And then with the client is free to bring up their own conclusions. Okay, so what does this tell you about your behaviors and your beliefs around handling rat feces? Does that make sense? Okay, so those are our 2 different types. We have our hypothesis testing, we have our general discovery experiments, and then we're either going to do an active experiment or an observational experiment, just depending on what's going on for the client and what's best suited for the client. Okay? Now remember, behavioral experiments can be pretty elaborate. They can also be really simple. And for example, one of the common things, like when talking with people about thought suppression and the problems with thought suppression, so trying to get certain thoughts out of your head, we may do a behavioral experiment like this one. So this is a really simple behavioral experiment that's going to take just a few minutes to do, okay? So in a minute, I'm going to ask everyone to try not to think about something. And I want you to do your very best to not think about this when I tell you. Okay, so ready? White rabbits. Do not think about any white rabbits. No matter what you do, do not let a white rabbit pop in your head. Okay, what did you notice? Was anybody successful in keeping white rabbits out? Great, okay, how did you keep the white rabbits out of your head?
By focusing on my breath.
Does somebody have the microphone? Here, why don't I'll hold on to it because I can get to them quicker. Okay. Turn it on? Okay. There you go.
The only way I could do it was by focusing my awareness where I want it, which was on my breath.
Okay, so you focused on something else. Is that similar to what other people did? Did anybody else do something different to get, no, that was the same. Did anybody do something different?
Pink pigs.
Pink pigs. Okay, so same thing, you focused on something else. Absolutely. Okay, so then I'm assuming the rest of you were unsuccessful. What happened? White rabbits everywhere, right? They're crawling on you, they're on the walls, white rabbits everywhere. Okay, so we found out it sounds like some people were able to be successful by focusing their attention other places. A lot of people had a really hard time, okay? So now we're gonna do our opposite, our B testing, which is this time, I want you to go ahead and notice the white rabbit. There's a white rabbit in this room. There might even be more than one. But what I want you to do is consciously try to notice what else is in the room. And if a white rabbit happens to hop along while you're noticing the other things in the room, like maybe the projector, or the chandeliers, or the lights, the person next to you, if a white rabbit happens to hop along, that's fine. We don't need to interact with the rabbit. Don't reach over and pet it. Don't talk to it, nothing. Just let it be there and just keep noticing everything else in the room. Okay, so what did you notice this time? How successful were you? Were you able to just let the rabbit be there? Did the rabbit multiply? What happened? Anybody from this side of the room? Yeah? I'll repeat back what you say. The rabbits went away. Okay, so when you didn't engage with them, they actually went away. Okay, did anybody else have a different reaction? Yeah?
The white rabbit kept going underneath people's chairs and nobody paid it any attention.
Okay, so it was going under everyone's chairs and nobody paid it any mind. Okay, great. So we have two different things here. One is to try your hardest to ignore it. We found out what? When you try really hard to ignore it, what happens? It multiplies, right? We did find out that if you focus your attention elsewhere, that might help, okay? Well, absolutely. Well, and actually, the second thing is the second experiment was actually a mindfulness activity, right? Which is not to just try to erase it by focusing on it, but let the rabbit be there, and to what we might even in CBT refer to as a diffusion strategy, which is to not interact with it. So it's there. I'll let it be there, but I'm not going to interact with it. And what happens if I just let it be there and don't interact with it, right? Mm-hmm. Oh, yes.
What I noticed predominantly, I focused on a gray elephant, so I was fine with the first one. But with the second one, I felt so much better because things were open and expansive. And in the first one, I felt very contracted.
Yeah, excellent. So even though the first one, where you were one of the people that you were able to remove the white rabbits by focusing on something else, you noticed that in the second one, you felt just more relaxed and open, not as kind of tense and retracted. Absolutely, yeah. Yes. No, I love troublemakers. This is good because this is going to fit in, yes.
When in the second experiment, when I heard your instructions, I pictured the white rabbit, and then I thought, what if it had big, sharp teeth, and it had my pants leg?
Oh!
Then it was a lot harder to
It was
ignore it.
really hard to just let it be there then. Absolutely, okay? And so tell me your name? Hochima. What Hochima illustrated so beautifully for us here is that obviously in this experiment, as the clinician, I was doing an A/B testing, right? And I had an ulterior motive in bringing this up, right? What do you think if I was doing this with the client, my ulterior motive is? What am I trying to illustrate to the client through this experiment? First, we're doing thought suppression, then we're doing a mindfulness activity, which is don't engage in the thought, just let it be there. What do you think my ulterior motive is as the clinician? What am I trying to illustrate to the client? What?
Demonstrating the second how it works, that it does work.
Absolutely, right? My ulterior motive is to show them that mindfulness practices, and specifically thought diffusion, is effective. Now, Hochima is my bad outcome, right? Which I love. The bad outcomes are important because remember, the purpose of a behavioral experiment is not to do what? Exactly. I'm not trying to convince them that I am right and they are wrong. So the bad experiment is my friend. Okay? Stay open to. That's why in the first one, and there usually are people who will focus on something else instead of the multiplying. And the thought suppression, what we're supposed to be illustrating is that they multiply, right? But you will always have people who will use a distraction strategy, and the distraction strategy is pretty effective. And so we roll with that. Yeah, tell me, what did you do? What was effective? How did you get that white rabbit to disappear? There is no such thing as a bad outcome in a well-designed behavioral experiment. In a well-defined behavioral experiment, all there is wonderful information. Hochima's rabbit growing teeth and eating her pant leg is wonderful information for me. If she's my client, this is giving me clues into what her troubling thoughts are doing to her, right? So I'm like, wow, yeah, that is extraordinarily hard to just ignore and let be there. Now we've got some really great information from doing our behavioral experiment, okay? But that was a really simple experiment that you can do in just a few minutes with people. So experiments can be really elaborate, or they can also be very simple and quick. So the one thing is that in order to have a good behavioral experiment, which based on my definition of a good behavioral experiment means I get what? Information. A good behavioral experiment yields information, okay? And I'm more likely to get information if I take the time to plan my experiment ahead, okay? So there are some questions here of what you want to be keeping in mind with behavioral experiments. So first of all, what is the belief that I'm testing, or what am I trying to explore? So in the example of the white rabbit one, this isn't the first time I've met somebody. This is where somebody's talking with me a lot about how hard they're trying to just make the thoughts go away, and they just need to make these thoughts go away. And we've been having these conversations about making these thoughts go away. And we might be talking a little bit about, but yeah, it sounds like you're working really hard to make these thoughts go away, but you're kind of having a hard time. It seems like it isn't really working out very well. I'm wondering if you might be willing to do an experiment with me. Could we test out this idea that you have about the importance of being able to make thoughts go away or make feelings go away? Okay, so I'm identifying what am I testing or exploring. And then what does the experiment entail? Get to a lot of detail. When you're setting up a behavioral experiment that you're either going to do with the client in your office, or they're going to go out and do on your own, we want to be really detailed. So if it's the walk down the street and say hi to people, how many people am I going to say hi to? What am I going to do when I say hi? Am I going to be making eye contact, yes or no? What am I going to be looking for? That's my next one. Oh, yeah, I've got that later on down there, is the outcomes. What am I going to be looking for? But we want to get a whole lot of detail. And then also how often. So how many people am I going to say hi to? If they're doing the behavioral experiment for homework, how many times are they going to repeat the behavioral experiment throughout the week? That sort of an idea. Is anybody going to be with them for the behavioral experiment? All these things are just going to be dependent upon your individual experiments. The next one is what will get in the way of doing the experiment. Don't assume that every experiment is going to go just fine, especially if it's a more involved experiment. Chances are something is going to get in the way. They haven't been doing this behavior already on their own. There's a reason why. So talk about what's going to get in the way of doing your experiment and how can I cope with these problems. So this is where experiments are helpful if you've already been using some other kinds of strategies that then you can incorporate into, and when I show you some examples of behavioral experiments later, you'll see those in there. Then the most important one, and this one, I'm really bad about this, especially when I'm setting up quick experiments. I'm really bad at remembering to get the prediction. And it's really horrible when I forget to get the prediction, because the prediction beforehand is actually what is going to be most likely to help shift beliefs regardless of the outcome of the experiment. Because what we have to remember, we were actually just having a big conversation about memory just the other day, is that memory is not constant. It changes, and it's highly influenced by how you're feeling right now. And if I have these, strongly held belief systems that have been in place for a while, there's lots of evidence that's reinforcing them throughout my life, and I'm really entrenched in these, then I am likely to interpret the results of any outcome through that bias. I mean, this is in research, this is in scientific research, this is talked about all the time,